Hello, this is Dr. Gay from First Look MRI, and this is a 51-year-old male with complaints of a hand mass and hand pain. It's been going on for about 2 years, and they finally came in to get it checked out with an MRI. They put a marker here on the palm. This is the back of the hand. This is the palm. To get oriented, this is the base of the thumb over here. This is the second, third, fourth, and fifth metacarpal bones. This is really the end of the first metacarpal bone here. And we can see these little dots here, these dark things are the flexor tendons. And over in the top here we see the extensor tendons. We also see something abnormal right here, this dumbbell-shaped area of brightness. This is a fatty tumor. You can see subcutaneous fat is bright. The muscle is dark gray. Marrow is bright, has a lot of fatty elements, and this is also bright, just like the subcutaneous fat. It looks exactly like subcutaneous fat, and it is very bright. And within there are some funny little curvilinear strands. A little piece of it comes over here beneath the fourth metacarpal bone here, and it protrudes down below, but it's a fatty tumor insinuating between the third and fourth metatarsals, and the complexity here is a little bit worrisome. When we see something very uniform and smooth, we call it just a lipoma. Simple lipoma, when it has these curvilinear bands like this can be an atypical lipoma that has a malignant potential. If there's lots of enhancement or a solid component that enhances, then we call it a liposarcoma. So this one's hard to tell in this view, but we're going to put up one with contrast and look at it. So this is one with IV contrast. So we're going to look at this tumor to see, does it enhance? Now fat is suppressed. It's dark on this one. See the fat in the marrow space is dark. The fat in the subcutaneous region is dark. This is all dark as well. So some of these little areas of fibrosis or little fibrotic strands here, some of them have faint enhancement, which is normal, but there's no solid component. And so this is an atypical lipoma. It's not a simple lipoma, but there again, there's no solid, worrisome enhancing components. So it looks like an atypical lipoma. These things can grow and these can degenerate into a liposarcoma, so you have to watch them carefully, and sometimes they'll just resect them, especially when they're this big and start causing trouble. So an atypical lipoma, or a lipoma with atypia we call it. This is a view of the hand. I measured it right here. This is a muscle, and see the muscle's displaced out of the way there. And there it is, a nice fatty tumor there in the hand. We'll look here in the sagittal images. Again, the gray is the muscle. We're going to get into it right now. Here it is. So there is that atypical, again, not a simple one, atypical lipoma that needs to be watched closely or resected. And that's it. Thank you so much.